Hi, I'm Dr. Evan Matthews. I'm talking to you today about exercise training, and this is going to be a basic exercise training video, so we're not going to talk about specifics to any particular sport or goal like weight loss. So this is just, again, an overview of exercise training. We can't talk about exercise training without talking about the fact that some people are just really good at this and some people are just not. That doesn't mean that they can't improve. Everybody can improve, and that's the idea here. But we're not all going to be professional athletes. In fact, most of us will not be professional athletes. And so we can't overlook the role of genetics here. All right, so there are simply high responders and low responders out there, which means some people, if you take two different people and do the exact same exercise with both of them, one person might do really, really well, or another person not so much. All right, but most of us are somewhere in the middle, and most of us respond fairly well to exercise. But with that said, here's a nice little quote here from some classic researchers in the field. So it's, if you want to become a world-class athlete, you must choose your parents wisely. So again, just emphasizing that fact that being an elite athlete doesn't necessarily mean that you worked for every bit of that. You had to have really good genetics in order to get to where you are with your sport. All right, so with that in mind, if we start looking at aerobic and anaerobic exercise, aerobic is about a 50-50 split between genetics and training. Anaerobic is a little bit more on the genetics side. And the reason why anaerobic activity is more genetically driven is because it's going to require a certain muscle fiber ratio, which is something that's determined very early on in our development, so when we're in the womb essentially. So your muscle fiber ratio, I'm talking about your fast twitch to slow twitch muscle fibers. If you want to be really good at anaerobic type sports, you need a lot of the fast twitch muscle fibers. And once you're born and you've developed far enough where all your muscle cells have kind of differentiated already, you're not going to be able to switch a type 1 fiber to become a type 2 fiber. So again, anaerobic exercise is much more genetically driven because of that than aerobic exercise. Let's talk about a few basic principles here and terminology that we need to be familiar with in order to ever train with somebody or to understand the training that you might be doing. The first term here is overload. So overload is a good thing. It's something that we need to do to our bodies in order to force our bodies to adapt. All right, so when we do exercise training, overload is what we're really trying to do. And so what this means is you do some sort of exercise that your body is capable of doing but not used to doing. It's going to stress your body in a new, novel way where your body is going to adapt to it. Hopefully it will adapt to it. That's the idea. And so once you start to adapt to that overload, your fitness level goes up, your body builds itself to be stronger and more capable than it was before. And so what you need to do is you need to progress that overload stimulus. So that's this word here, progressive overload. All this is continuing to make sure that the training stimuli that you're applying to your body or to your client or to your athlete is intense enough to be a continual overload for that individual. So if you do the same thing on day 60 that you did on day 1 of a training regimen with somebody, it's unlikely that on day 60, after they've been training for 2 months essentially, that it's going to continue to overload the body. So again, this is why we have to progress the overload so that we progress as our fitness levels go up. And so again, if our fitness levels go up and we don't continue to progress that overload stimulus to match just above the fitness level, then what's going to happen is you're going to plateau and you're going to stagnate and you're not going to continue to improve. The next principle I want to bring up, and this is a really important one, as well as the idea of specificity. All right, so specificity means that you need to train your body in the way that you want to be able to use your body later on. All right, if you're an athlete, this will make a lot more sense. So let's say you are a distance runner. Okay, that means in order to be specific to your sport, you need to be running during your training. So instead of cycling in order to become a distance runner, that violates the principle of specificity. You need to be running in order to be a distance runner. Likewise, let's say you're a powerlifter. You don't need to be running. If you're running, you're not doing an exercise routine that is specific to your sport or specific to the activities in your sport, and so it's not going to help you. And so you can make this a little bit more applicable to team sports if you start thinking about the actual movements. So maybe a lineman who pushes a lot in their sport, so a football lineman, you should be thinking about the activities that you can do in training that it's going to require them to push. So things like the bench press. If you want them to be better at pushing, you need to make them push during the training. All right, so this idea of specificity can be applied in lots of different ways. Specificity of modality, specificity of movement patterns, specificity of movement speeds, specificity of the bioenergetic systems that are used, specificity of everything. The more specific the training to the sport or the performance they want to be better at, the more likely they are to actually get better at that. The next training principle is one that we don't talk nearly as much about, but it's important, is the idea of reversibility. Once you get to a certain level with your fitness, if you stop training, you're going to reverse back down to a previous, less trained version of yourself. If you don't continue to apply a stimulus to your body isn't going to maintain that tissue and those systems in order to be able to deal with that level of stimulus if you're no longer applying it to it. So the body is very efficient. It wants to only build itself up to the level that is necessary in order to sustain what it perceives as your sort of normal daily life. And then the last training principle here is the idea of rest. We cannot expect our bodies to improve after a training stimulus if we don't give it the appropriate amount of rest. All right, so every time you train your body, what you're doing is you're doing little tiny microscopic damages to your body. Your body's collecting these small tears and these overload stimuli, and when you go to rest is when your body is going to go and repair the damage done by that overload stimulus. And when it repairs itself, hopefully it's going to repair itself stronger than it was before so that you are at a higher fitness level now. However, if you don't rest, it can't do that, and so you're going to continually break down the body until either you become overtrained, you get sick, you get injured or whatever, or you're just going to have a major injury that happens all at once. Your muscle's going to tear, your bone's going to break, something like that. So rest is just as important as the idea of continually overloading the system in order to train the system. Because without the overload, you can't improve, but without the rest, you can't repair and to actually build the tissue up from that overload stimulus. With all that said, let's talk about what a single workout should look like. So you should always start a workout with a warm-up. And so the idea here is that you're going to progressively increase your exercise intensity until you meet the level that is going to be used during the actual athletic event, if it's for a sporting event, or during the actual training, the core part of the training workout. So if you don't increase your exercise intensity slowly in order to meet this, you're going to have more likelihood of getting injured and having all kinds of other things going wrong. So the reasons why we warm up is to increase cardiac output and blood flow to the skeletal muscle that's active. And so that's going to bring to it oxygen, it's going to bring to it nutrients. We're also trying to increase the temperature of the muscle and the enzyme activity of the muscle. So when we talk about enzymes, think primarily bioenergetic enzymes. So the enzymes used to break down carbohydrates and break down fats in order to turn it into ATP, which is the unit of energy your body uses. With this increase in blood flow, the muscle is going to become a little more lax. It's not going to be quite as tight, which is why when you're in the workout, you usually don't feel quite as rigid as you do at the very beginning of the warm-up. And so that's going to decrease injury risk, which is one of the primary reasons why most people cite for the warm-up, and it's definitely an important reason for it. Another good reason to warm up, and this is going to be more important for people who are a little older, people who might have an undiagnosed disease or diagnosed disease of the cardiovascular system, and it's going to decrease the likelihood of having some sort of cardiovascular event during the exercise bout. So if you slowly ramp up your warm-up into the exercise intensity, you're going to be slowly turning on your sympathetic nervous system, which is going to be what increases heart rate and lots of other things that are necessary for you to exercise. But if you don't do it slowly, it can be kind of a shock to the system, and it can cause the heart to be a little more irritable than normal. You can go into an irregular heart rhythm that can be dangerous if it's certain types of heart rhythms, or you can just dislodge a plaque or whatever else, causing things like strokes and heart attacks. So if you slowly warm up the individual, they're less likely to have some sort of negative cardiovascular event, the kind of thing that's going to lead to hospitalization or even death. After the warm-up here is when we get into the main workout. The main workout we're not going to talk a lot about right now. We'll talk more about in a minute here. Main workout is essentially where you're going to work on your training goals, all the things that are the reason why you're doing all this exercise in the first place. All right, so after the workout, 10, 20, 40 minutes, however long that is, then you're going to go into the cool down. The cool down is essentially a reverse warm-up, which is why some people actually call it a warm down. Right? So you're going to just start at the exercise intensity that was used during the main part of the workout, and you're going to gradually decrease it down to near resting levels. And with that, you're going to slowly bring down your heart rate. You're going to slowly bring down your respiratory rate. You're going to slowly bring down your blood pressure. And all of this is going to allow your body to adjust more gradually from high exercise intensities down to resting. All right, so if you don't gradually decrease your exercise intensity in some sort of cool down, what's going to happen is you're going to again shock your system. You're going to cause your sympathetic nervous system to increase its activity dramatically at that immediate stop of exercise. So if you're sprinting, you stop and you sit down, you start getting all those sensations of you're blacking out. You might get nauseous, those sorts of things. That's because you didn't do an immediate cool down. Right? If you would have kept going at a lower intensity, slowly bringing down the exercise intensity, that wouldn't have happened. And so what that is it's blood pooling in your legs, your arms, and your extremities, and it's not getting back to the central part of your cardiovascular system, so back to your heart to be pumped to the body again, specifically being pumped to the brain. That's why you're feeling the sensations that you're going to black out. So if you're not doing that, your brain's going to increase sympathetic activity in order to try to force the blood back to the heart and back to the brain. And again, large spikes in sympathetic activity can cause irritability of the cardiovascular system and cause some sort of cardiovascular event like a heart attack, stroke, whatever. So the reason why we cool down is to prevent that. And again, in a normal, healthy individual, the chances of that are pretty slim, but you don't know if you don't have a disease oftentimes. This is why sometimes, really highly trained athletes will just drop on the basketball court or something like that because they had an undiagnosed cardiovascular disease. Also, obviously, if you're working with older adults or people with some sort of known disease or risk factors suggesting that they might be developing a disease or signs or symptoms that they might be developing a disease, then those people definitely the cool down is super important for. But regardless, we recommend that everybody do a cool down for this reason. So some things that the cool down does not do. All right, so there's a lot of myths out there about the cool down. It does not decrease soreness. It also does not decrease the injury risk from the exercise. So if you think about soreness, so what is soreness? Soreness is little microscopic injuries that were done to the muscle fibers, so done to your muscle during the actual workout phase of the workout session, so during the main part of the workout, And so if you don't do the cool down, those microscopic injuries, they're already there, so it's not like you're going to prevent them from being there by doing a cool down. That's just not how it works. You need to give your body time to recover and to rest and heal that tissue back to that training principle of rest. So doing the cool down is not going to get rid of those little tiny injuries, those microscopic injuries. So it's not going to decrease soreness. It's also not going to decrease injury risk because the injury that you're going to get is probably due to those little microscopic injuries if you're not giving yourself enough rest or if you're doing too much of an overload stimuli, and those injuries become bigger and bigger and bigger to the point where it's what we actually typically call an injury, and then you have a torn muscle, ruptured ligaments, something like that. And so again, the cool down is not going to prevent that because that probably would have happened during the warm-up. So it's not going to prevent injuries. It's not going to prevent soreness. Let's talk about stretching just for a moment here. The very end of this series of videos on this training topic, we're going to talk about stretching again, but let's just briefly talk about when we should stretch and what types of stretching we should do. Stretching is really good for maintaining or improving our flexibility, and that's the reason why we stretch. All right, so a couple of reasons we do not stretch. Again, some myths here. We do not stretch to decrease injury risk. We also do not stretch to decrease muscle soreness. Neither of those things are real reasons to be stretching. Now, I will say there's a little caveat to the injury part of this. So assuming that you are flexible enough for your sport, your activity, whatever it is you do, increasing your flexibility more is not going to decrease your injury risk. Or stretching right before the event probably isn't going to do much, if anything, to decrease your injury risk. If you are not flexible enough for your activity, let's say you're trying to become a gymnast, which is a sport that requires lots and lots of flexibility, but you're brand new to it, you don't quite have that flexibility yet, you need to work on your flexibility. You need to stretch often in order to improve your flexibility. Otherwise, you are at an increased risk of injury because you're not able to go to that range of motion you need to for your athletic event. And so if you don't improve your flexibility to be able to go through that full range of motion that you need to, then you are constantly putting your muscles and your ligaments and your tendons at a very high strain, increasing the risk of injury. But again, if you're flexible enough for your sport, stretching isn't going to prevent injuries. There's no good evidence to suggest that. There's some studies that say it does, some studies say it don't, but in general they say it doesn't. So stretching does not prevent injury. Also doesn't prevent soreness. All right. So what was soreness? Soreness was the microscopic injuries in the muscle, and the process of healing those injuries causes some muscle soreness and tightness and things that we associate with after exercise. So quickly, what kind of stretching should you do and when? So most people are going to recommend that you do some sort of dynamic stretching during the warm-up. This is going to be basically moving your limbs and your muscles through a full range of motion in a slow to moderate speed, but in a very controlled pattern. All right, so you're very controlled with the movement. You're not just flailing your arms around, and that's going to force yourself through the range of motion, slowly warming up the muscle more, which is why it's partially good for being in the warm-up. It's going to increase your flexibility acutely, so as in the next few minutes, so that you can get to the main part of the workout and perform as you need to. During the cool down, we generally recommend static stretching or maybe even proprioceptive facilitation stretching, PNF stretching. And PNF stretching is kind of like static stretching, but with a contraction that adds to it an extra level of intensity. But let's talk about that later on. Essentially, the reason why we recommend static and PNF stretching during the cool down and not during the warm-up is it's going to activate the Golgi tendon organ. The Golgi tendon organ causes inhibition to the muscle, which is what allows you to increase your range of motion after doing static stretching or PNF stretching. However, if you're inhibiting the muscle from contracting and you're doing that during the warm-up, and then you're going to go into the main part of your workout and you want that muscle to contract, it does have the ability to decrease power development, strength development, speed, all the things that you're going to need in order to perform well during your workout or during your athletic event if it's, you're warming up for some sort of sporting event. All right, so again, no static stretching, no PNF stretching during the warm-up. Dynamic stretching is good there. During the cool down though, go ahead and throw the static and the PNF stretching in there. Let's look at the year-round training program that's sort of most stereotypical for most athletes. So basically here we're talking about periodization. Periodization is the idea that you shift your focus from one period of time to another period of time, often referred to as mesocycles, in order to build your fitness level up. So you work on one component of fitness, then you switch to another component of fitness that's going to build on the last one, so on and so forth, making yourself a better athlete or a better trained individual later at some ideal time, say like a championship season or a championship event or of some sort. All right, so during the off season here, so we have, let's look at the graph for a moment. We have the off season, we have our preseason, which is pretty short, we have our in season, and we have our post season. All right, so the off season, during that period of time, your training volume is going to increase a lot and it's going to stay very high. And training volume means the total amount of work that you're doing. So if you're talking about running, it's how many miles or minutes or kilometers you're going to do in a week's time. If you're talking about weight training, how many repetitions multiplied by the intensity of those reps, so how much weight you're moving per rep, that would be your volume. So high volume activity during the off season is generally what is recommended. The intensity is going to be somewhere in the middle here for the off season. So you are working at a high intensity level, but it's not as high as you will be later on during the preseason and in-season period. During the off season, your skill-based technique training. So this is dribbling, this is passing drills, this is running plays, whatever it is that you need to do for your sport. Your technique training is usually pretty low during the off season. You're mostly doing your conditioning during the off season, right? So again, high volume, moderate to high intensity, but very low technique. All right. When we get to the preseason here, technique's going to start to go up, intensity is going to go up a little bit, volume is going to start to plummet during the preseason. Once we get into the actual in-season period, so this is when you're going through competitive events on a regular basis. We're talking about athletes here, obviously. Maybe you have a weekly track event or a weekly game, Friday or Saturday game or whatever it is. So you can't have very high training volumes during this period of time because you're going to increase your likelihood of getting injuries. Also, you're going to be more exhausted. High training volumes means more fatigue typically. All right, so you want to bring down the training volumes progressively across the season. So you don't want to plummet it all the way down to almost nothing at the beginning because then you'll eventually detrain and lose your fitness level. But slowly bringing it down while at the same time slowly ramping up your exercise intensity and focusing a lot more on skill-based technique type training. All right. Once we get to the end of the in-season period, you should do what's called a taper. And we're going to talk about this more, but basically with this more decrease in the volume, oftentimes more dramatic than what's being shown here. You plummet your volume quite a bit, and it's only a week or two that we're talking about here. Meanwhile, your intensity stays pretty high and your technique goes really, really high. You really focus on the technique. And at the end of the taper is usually when you have your athletic event that's your championship. During the postseason, you're going to plummet your volume even further, maybe plateauing eventually if your volume's already pretty low. Your intensity is going to drop, your technique, skill type activities are going to drop. And essentially during the postseason, for a lot of people, it's best to just stop everything, stop all training for a period of time. The idea here is to heal any small or nagging injuries and also to rejuvenate the mind, get the mind ready to go back into off-season training again where there's going to be this high volume, moderate intensity for a very long period of time. So if you don't give your athletes a chance to just sort of decompress mentally a little bit, they're going to slowly decrease their motivation and more likely their exercise intensity is going to drop with that. So postseason is really just about recovery. What you do during that isn't very important as long as it's not high intensity, high volume. You'll probably be okay. All right, so let's talk about some of the goals of specifically the off-season and the preseason and the in-season. We're not going to talk much more about the postseason. Again, it's just to recover, essentially. The primary goals of the off-season are going to be improved cardiorespiratory endurance, improved muscular strength, muscular hypertrophy, or muscular endurance. And these are which one of these is going to depend on your athlete and your sport. So you're going to probably pick the one of these that they are weakest at and make that the focus, or you're going to pick the one that's most important for the sporting event that they are doing and then make that the focus. So for instance, if you have an athlete who is a shot putter, so somebody who their entire event is less than a couple of seconds long, cardiorespiratory endurance probably isn't that important. It's not going to be your focus. You're going to focus more on hypertrophy probably for these people and a little bit of muscular strength as well. So some secondary goals to the off-season training are to prevent excessive fat gain. So usually during the off-season, diets become a little more loose. People aren't watching what they eat quite as much because it's not quite as important if they gain a few pounds of fat. And oftentimes that's actually a benefit because it allows their body to recover a little easier and a little faster from training sessions. You're also trying to maintain bone and ligament integrity. So in other words, you need to maintain some level of volume in order to make sure that the bones and the ligaments don't weaken from disuse. And you're also going to try to just maintain skill level. Remember, skill and technique are pretty low on the sort of importance and the time you give to it during the off season, but you don't want to completely lose it. So you do a few skill drills here and there just to make sure that they are maintaining some level of skill. During the preseason, your goals are pretty much going to be improving muscular strength or power or both, and using the energy systems that the body is going to use during your sporting event. So again, if you're talking about a shot putter, you're probably going to focus a lot on the power here because they need a lot of power. And you're probably going to focus a lot on phosphocreatine stores for somebody who's maybe doing several shot puts attempts in a short period of time, but more than likely that's probably not the best example. Let's talk about maybe a basketball player. So a basketball player, improving power is going to also be important because it improves speed. And you're probably going to want to work on your glycolytic systems, maybe a little bit on your aerobic systems, but probably more the glycolytic and the phosphocreatine systems. So with that, you're going to do short to mid distance interval training as well as some weightlifting and things like that in order to boost the strength, the power, and the energy systems of that athlete for the sport they're doing. And then during the in-season, really you're just trying to maintain your muscular fitness because your volume's dropping off. So you're not going to improve certain aspects of your muscular fitness like muscular endurance, hypertrophy. They're not going to go up a whole lot. They're probably going to just kind of hopefully plateau and not go down. That's the idea. But you're going to focus more on the skills, the actual movements of the sport and the drills and the plays and doing things like that. That's going to increase their ability to do the sport that they are training for. So I already briefly mentioned the idea of a taper, but let's hit it a little harder here. So a taper is a short-term decrease in the training volume immediately prior to a competition. So anywhere between a couple days to maybe 2 weeks or so. It says a few weeks here, but typically it's 2 weeks, maybe 3 weeks, but it's much more rare. 1 to 2 weeks is usually about what people do for a taper. And so again, you're decreasing the training volume, but you're maintaining the exercise intensity, and that's important. So if you decrease both the volume and the intensity, you're going to get a little bit of a detraining effect. If you just decrease the volume, the detraining isn't going to be very noticeable if it happens at all in such a short period of time, which is why the taper should only be a fairly short, a week, 2 weeks, maybe up to 3 weeks. Longer than that, and they're more likely to get some detraining effects. So during this, what's going to happen? You're going to allow the muscle to synthesize a lot more muscle glycogen, so it has a lot more stored glucose in it, which is good for athletic performance. It's also going to heal any minor training-induced injuries, so that once they get to the end of the taper, which should be coinciding with some sort of special event, a championship event of some sort, they're going to be fully engorged with glycogen so that they have a lot of energy in their muscles, and they're also going to have fully recovered, healed muscles so that they can perform at a high level. With a decrease in training volume, a lot of athletes are going to get a little bit of anxiety that they're going to detrain too much and they're going to lose their fitness level. All right, remind them that most athletes can decrease about 60% of their training volume for a short period of time without losing any performance, so without losing their fitness level. So that's something that you might need to remind them of. And in fact, their performance is actually going to go up, which is the whole idea of the taper here. So if you're talking about endurance-based individuals, so if you think about like race time, so if you're doing like a 5K road race or whatever it is that you're training for, you're going to see about a 3% improvement in your race performance. So endurance sports, you're going to see about a 3% improvement is what I'm trying to say. The strength and the power sports, so think your football players, maybe a little bit to the basketball players, whatever it be, they're going to see also a pretty big improvement, actually a much bigger improvement than endurance athletes will. They're going to see about 18 to 25% improvement in their performance. And so the taper is something that is going to be helpful regardless of the type of sport. There might be a few exceptions, but most sports are going to see an improvement in performance after a taper. So when you're doing all this training across the seasons, you're going to be constantly depleting your muscle of glycogen. And that's good for training the muscles in order to replenish glycogen faster and to build more glycogen stores. But eventually you're going to need to replenish enough of that glycogen in order to perform well. All right, so you can't train hard all the time, in other words, because if you do deplenish your glycogen, your time to exhaustion is going to come way down, your performance is going to come way down, and so oftentimes what you'll see people do is to try to increase the carbohydrate intake through their diet. So improving how much carbohydrates they bring in is going to increase the muscle glycogen, and it's going to increase the performance of the athlete. Especially we're talking here about athletes who are typically going to run out of carbohydrates in some sort of, long type sport or endurance type sport, something like that, maybe soccer, running, whatever. And so these athletes are going to benefit from something called muscle glycogen loading, also called supercompensation, and probably the lay term for this would be carb loading. Okay, carb loading is going to be something that you do in the days to week leading up to a major event, usually at the same time as a taper, and you're going to increase your carbohydrate intake at some point in time in order to maximize your muscle glycogen stores so that you have as much glycogen in your muscles as possible during that athletic event. Let's go over a couple of the various glycogen supercompensation regimens that are out there. So now, again, carb loading regimens. All right, the classical regimen first. So this graph here I know has a lot going on, but let's go step by step, and you can also read the text over here to try to make sense of what's going on in this graph. So we have the days going from day 1 to day 7, and day 7 is where you're going to have a major athletic competition where you're trying to carb load for. So again, a major event, a championship, something like that. On day 1, during the classical glycogen supercompensation model, what you're going to do is some sort of prolonged strenuous exercise bout that's going to deplete your glycogen stores as much as possible. So that bout's going to be very, very high. So looking at this gold colored line here, this is your exercise training in minutes. It's going to be typically recommended to be something really high, 90 to, this is 100, so 90 to 100 minutes or beyond for an endurance type athlete. A lot of this is based on endurance athletes, but some modified version will work with people who are not distance runners, essentially, which is what this was originally designed for. All right, so 100 minutes, maybe more than 100 minutes for highly trained athletes. That's going to really push their glycogen stores and deplete it as much as possible, which is the idea here. And the glycogen stores are this purple line, so you can see that the glycogen stores plummet quite a bit when you do that. You're also going to, at the same time, during this classical model of glycogen supercompensation, you're going to start a high-fat, high-protein, low carbohydrate diet. So again, you have this really high intensity exercise bout that's going to deplenish your carbohydrate stores, the purple line, and at the same time you're going to decrease this red line. You're going to decrease the total carbohydrates you're going to bring in the day, and so you're not going to replenish the carbohydrates that you burned up. And then what you're going to do is you're going to train as normal for a couple of days here, and at the same time you're going to maintain the super low carbohydrate diet. At the end of 3 days, you're going to do another high training stimulus, probably not as high as the first one because you're just not going to be capable of it. Also, it's only a few days out from the major event. You don't want to risk some sort of injury or muscle soreness that might come from a really strong, long duration exercise bout. And so sort of moderate to long exercise bouts to deplenish your glycogen stores even further, which is what's going on here. And then when you finish that exercise bout, you're going to immediately go out and you're going to start increasing your carbohydrate intake. Okay, and then you're going to increase your carbohydrate intake to about 90% of your total calories per day being carbohydrate. So a lot of carbohydrates here. And then you're going to maintain this. You're going to maintain a super high carbohydrate intake all the way up until the athletic event. Meanwhile, after that last hard exercise bout on day 4, day 5, and 6, you're going to basically do no activity at all, at least no exercise, just maybe normal walking, something like that. So you're going to plummet your exercise training volume and intensity, and you're going to see this huge increase in muscle glycogen stores that's going to peak somewhere around the end of the week. And so this can maintain itself for 4 or 5 days. So if you don't quite hit it right, that's okay. You have a window of about a half a week or so, maybe a little longer than half a week, where your muscle glycogen stores are going to stay really, really high. And again, this is going to help you to improve your athletic performance. Looking at this, you can probably see some potential flaws in this. You're eating this super low carbohydrate diet for about a half a week, a few days or so before before a major athletic event, you're not going to feel very good, especially if you're used to eating a more moderate to high carbohydrate intake. So your brain's going to be constantly starving of carbohydrates. You're probably going to be pushing yourself into some sort of ketogenic state, and you're going to feel cranky, you're going to feel irritable, you're going to feel sluggish. Your body's just not going to feel good. And so this is really bad for the mindset leading up to a major event in just a few days. And there's some other potential downsides to this where you might not recover quite as well from exercise that you're doing during this first half a week when you're still training. And so the classic model, while it does work, you do get this huge muscle glycogen store. It's got a lot of issues that might decrease exercise performance regardless of muscle glycogen stores. With all those issues, people have worked to do to create a modified regimen for muscle glycogen supercompensation. And so that's what's being showed on this slide here. What happens during the modified version of this is essentially on day one, you're just continuing your normal training and eating routines. You're not modifying what you're doing at all. So this is a 1 day shorter muscle glycogen loading regimen. So instead of being 7 days, it's really just a 6-day model. On days 2 and 3, what you're going to do is you're going to decrease your exercise training volume by about 55%. So that's being shown here by this gold line decreasing, and you're going to maintain that for a couple days. Meanwhile, you're going to eat about 50% of your diet as carbohydrates, which is around what most endurance type athletes are going to be eating anyways. And so really you're just maintaining your diet from before this week. And during this period of time, your muscle glycogen isn't going to change a whole lot. It might have gone down a little bit at the beginning of the week. Maybe it's upsloping just ever so slightly, but it's mostly just flat. On weeks 4 and 5, what you're going to do is you're going to further decrease your exercise volume by another 50%. All right, so you're going to cut it in half again, and you're going to maintain a low volume of training for 2 days. During that period of time, you're going to increase your carbohydrate intake up to about 70% of your total calories per day, and you're going to see that muscle glycogen starts to go up pretty quickly. All right, so muscle glycogen is going up because your carbohydrate intake is going up and your exercise training is down to much less than what you normally do. Then the day before the competition, you're going to take off. You're not going to train that day. So day 6, there's going to be no exercise. Meanwhile, you're maintaining this 70% carbohydrate intake diet, and your carbohydrate stores, your glycogen stores are going to continue to go up all the way until day 7, which is, again, your competition day. As already mentioned, this or the classic model for muscle glycogen loading is going to be able to maintain high muscle glycogen levels for about 5 days, so a little less than a week, so half a week to a week, somewhere in that range, allowing yourself to allowing yourself to compete at very high levels at some point during that period of time. And so benefits of the modified routine, besides the fact that it's a day shorter, you're not going to be plummeting your glucose intake or your carbohydrate intake, and so you're not going to feel cranky, you're not going to feel irritable, you're going to recover from exercise just the way you normally did. All those things are going to benefit your state of mind as well as your preparedness for your athletic event that's coming up. And meanwhile, the last few days, when you dramatically increase your carbohydrate intake and dramatically decrease your exercise volume, you're going to see a very similar increase in carbohydrate storage, so glycogen storage in the muscle. And so you get about the same results from the modified regimen as you did during the classical regimen, but without a lot of the negative side effects. So most people nowadays don't do the classical regimen. They're going to do something more like this modified regimen. Now that we've gone through a lot of sort of general overview information on exercise training, let's talk about some common training mistakes that happen. So the first one is overtraining. We're going to talk more about this in the slides to come. But basically, your workouts are too long, they're too strenuous, you're not giving yourself enough rest and recovery. And so overtraining is going to lead to all kinds of injuries, illnesses, things like that. And generally speaking, you're better off undertraining the individual and not quite reaching their capacity than overtraining the individual and passing the capacity and seeing a plummeting performance level afterwards. So then the second part of this would be undertraining is also a problem, but it's not as big of a problem as overtraining. If you're not training quite enough, you're just not hitting your capacity. But if you're overtraining, you're past your capacity and you're not going to be able to do much of anything. So overtraining, again, way worse than undertraining. Performing non-sport specific exercises. So in other words, not adhering to that specificity principle. Remember, it's specificity of everything. So movement pattern, speed of movement, muscles used, energy systems that are used. If you're not training specific to the athletic event you're trying to be better at, then you're not going to get that much better at that athletic event. So you have to be training with training specificity. This next one is one that most young athletes are going to do. So failure to make a long-term training plan. All right. So if you don't plan out your training for a very long period, a year or even up to, some people, Olympic level athletes are doing 4-year training plans so that they can be ready for the Olympics. But again, some sort of long-term training plan, at least a season in length, is going to be necessary in order to not misuse the time you have. All right, so if you don't transition from one emphasis to another or from one mesocycle to another when you need to, you're losing time, and that's going to decrease the end goal of being as highly fit as possible during your basically championship season. And the last one here is not tapering when you should taper. So I mentioned overtraining is really, really bad, and it is. So let's spend a little bit of time talking about that in more detail. So what's going to happen? So if you're overtraining, you're going to have a decreased performance, which is the main variable that most athletes are going to be all that concerned about. But you're also going to have some psychological problems, things like lack of motivation, inability to concentrate, so mentally concentrate. You're potentially going to see some depression in your athletes. They're going to have sleep and emotional disturbances. So all these things are going to make them less likely to be able to focus on their sport, as well as a lot of these are going to be student athletes. They're not going to be able to focus on their academics, and they're just not going to perform well because their heart isn't in it. You're also going to see physiological problems here. So these are the ones that are probably studied more often and more obvious to people. So they're going to see an elevation in their resting and submaximal heart rates. Basically, their heart's constantly being stimulated by sympathetic activity, and it's always at a higher level than it should be. Blood pressure is typically going to be higher as well. Blood lactate levels are typically going to be higher. All these things are negative signs suggesting that the body is overstressed and overworking. All right, so oftentimes when people are trying to see if somebody is overtrained, they're going to look at the resting heart rate, and typically it's going to be done as soon as they wake up in the morning. They're just going to measure the resting heart rate and track that across time. It's not a perfect measurement to determine overtraining, but it certainly does help. So if somebody's resting heart rate slowly drifts up over time, that suggests that they're not adapting to the training as well as they could or should. Some other physiological problems that are going to happen, they're going to have potentially a loss in body weight, and this is going to be driven by the fact that they're going to have a reduction in their appetite. So they're just not going to eat as much as they need to, and so their weight's going to drop. This is going to contribute to the next one here, which is a feeling of chronic fatigue. So they're overworked, and they're also not eating enough, so they're going to feel fatigued all the time. They're just not going to feel energized, they're not going to feel good, they're not going to train well, they're not going to perform well. And you're going to have multiple bouts potentially of injuries and illnesses. Things like colds are going to sneak up on them. Small injuries, tendonitis, that kind of stuff is going to creep up on them. Shin splints is going to creep up on them. And this is just going to happen over and over and over again. So when you have overtraining syndrome, in other words, overtraining, there are going to be some changes to the hormones of your body. You're going to have a decrease in your resting thyroxine levels, which is a metabolic hormone. You're going to have a decrease in testosterone levels, which is important for recovery from exercise. You're going to have an increase in cortisol levels, which is your stress hormone. And oftentimes people will measure a testosterone to cortisol ratio. And if this goes in the wrong direction, direction, in the direction of higher cortisol, lower testosterone. This is going to indicate that your anabolic recovery processes aren't functioning the way they should, and that you are probably going to be breaking down, so protein catabolism, you're going to be breaking down protein more than what you want to, which typically you want to minimize that as much as possible, because breaking down of proteins typically means breaking down of your skeletal muscle, so your muscles are going to atrophy and weaken and potentially get injured from that. You're also going to see an increase in blood urea concentration. This is a byproduct of protein breakdown, so that protein catabolism I was just mentioning, and you're going to see an increase in catecholamines. And what catecholamines, I'm really talking about the sympathetic nervous system's neurotransmitters, so norepinephrine and epinephrine. They're going to increase, suggesting that your body is in a constant sort of state of mild to moderate, anxiety almost, and you're going to eventually it's going to lead to issues as well. All these symptoms are much more likely with volume-related overtraining than intensity-related overtraining. So volume-related overtraining meaning too many miles per week, too many minutes of something, whatever it is, too many repetitions, much more likely to experience overtraining from that. And as mentioned, volume-related overtraining is much more common than intensity-related overtraining. And because of this, overtraining is usually something that is going to be seen most commonly in endurance-type sports. So in endurance sports, you're going to also have very high injury rates, partially driven by this relationship between overtraining of volume and overtraining syndrome. So they're going to have much more injuries in these endurance-based sports, and that's going to require you to watch their training levels a little more closely than some other sports. Typically, the volume of training should not increase by more than 10% per week. So let's say, just to make these numbers easy, let's say you're doing 100 minutes a week of exercise. That means next week, at most, you can do 110 minutes of exercise. So that's a 10% increase. So 105 minutes is fine. 115 minutes, which would be a 15% increase, is not fine. So 10% or less, typically you want to go a little less than 10%. 10% is still a pretty big jump, but once you get beyond 10%, that's when you're highly likely to run into overtraining syndrome. Let's go ahead and stop there. That was an overview of basic training principles. Next, we're going to go into training for aerobic exercise. And then on the third part of this video, we're going to go into training for anaerobic exercise. So please come back and watch those. If you have any questions or comments on this section, please put those in the comment section below and I'll try to get back to you. Again, otherwise, please come back and watch another video. Thanks.